Good day and welcome to our final SALMA webinar for 2023. It has indeed been a busy year for us all, and I trust that we're looking forward to enjoying some downtime with family and friends. And for those of you who are fortunate enough to break away and visit another town or even another country for the upcoming festive season, I've compiled this presentation especially for you. We all know how important physical activity is, and it often is neglected over the festive time, as we're just too busy visiting, exploring, traveling, eating, sleeping, and the list goes on and on. In today's webinar, we'll explore the basics about physical activity, the impact it has on chronic diseases, and how we can implement all forms of physical activity into our daily lives for optimum benefits. And of course, how to maintain an active lifestyle throughout the upcoming silly season. Let's start off by covering the basic definitions related to movement, physical activity, and exercise. Movement is the process of moving the human frame, something as simple as turning in bed or lifting an arm or a leg. Physical activity is any movement of the body produced by the muscles contracting and the bodily energy being used. NEAT is the acronym for non-exercise activity thermogenesis, which I'll give more detail about later in the presentation. This is basically all the activities that exclude sleeping, eating, or organized exercise. NEAT includes many activities such as walking to work, typing, gardening, standing, fidgeting, dressing, and cooking, also known as activities of daily living. Exercise, on the other hand, is physical activity that is performed regularly in order to develop and maintain physical fitness. Exercise is physical activity that is mostly planned and structured. The four basic types of exercise we find are aerobic exercise, strength training, stretching, and balance exercises. Aerobic exercise gives your heart and lungs a workout and increases endurance. It has been shown to help relax blood vessel walls, lower blood pressure, burn body fat, lower blood sugar levels, reduce inflammation, and boost mood. Combined with weight loss, it can also lower bad LDL cholesterol levels. Over the long term, aerobic exercise reduces your risk of heart disease, stroke, type 2 diabetes, breast and colon cancer, depression, and falls. Strength training. Strengthening your muscles not only makes you stronger, but also stimulates bone growth, lowers blood sugar, assists with weight control, improves balance and posture, and reduces stress and pain in the lower back and joints. These should be performed 2 to 3 times per week, but not on consecutive days. Stretching. These help to maintain flexibility of the muscles. As we age, we lose flexibility in the muscles and tendons. Muscles tend to shorten and don't function properly. This increases the risk for muscle cramps and pain, muscle damage, strains, joint pain, and falling. Balance. Improving your balance makes you feel steadier on your feet and helps prevent falls. It's especially important as we get older, when the systems that help us maintain balance, like our vision, our inner ear, and our leg muscles and joints, tend to decline. You'll notice that Pilates falls into 3 of the 4 exercise types, possibly enjoying an unfair bias as I happen to be a Pilates instructor. But from personal experience, I have seen how Pilates has changed my physical abilities and that of my clients. It's a low-impact exercise that incorporates strength training, stretching, posture, breathing techniques, and balance into one exercise session. If you haven't tried it yet, it's worth finding a qualified instructor in your area. The rate of perceived exertion, also known as RPE, is a helpful scale that guides professionals in the fitness industry and their clients to obtain the desired physical and fitness results by training in the different RPE zones. Notice RPE 4 to 6, which is moderate activity, where the client will be breathing heavily and can hold a conversation. This would be something like brisk walking or a leisurely bike ride. RPE 7 to 8 is vigorous activity, which is borderline uncomfortable, where you are short of breath and can speak a sentence. These are the 2 zones most commonly recommended for aerobic training. Now let's shift focus to a physical activity report issued by the World Health Organization in October of 2022. More than a quarter of the world's population is not active enough. 1 in 3 women and 1 in 4 men are not active enough to remain healthy. Inactivity is twice as high in high-income countries in comparison to low-income countries, possibly due to the modern lifestyle conveniences like cars, vacuum cleaners, dishwashers, and washing machines that the lower-income countries cannot afford. And how often are expensive gym memberships not used in these more affluent countries? Inactivity levels increased by 5% in high-income countries from 2001 to 2016. There has been no improvement in global physical activity levels since 2001, despite us knowing how important physical activity is. This just speaks of the fact that knowledge does not always translate into behavior change. Physical inactivity is a leading risk factor for non-communicable disease mortality. Sedentary individuals have a 20 to 30% increased risk of death compared to their physically active counterparts. These statistics are not only shocking but also concerning, as health professionals in South Africa are faced with the consequences of poor lifestyle choices, as we see our patients struggle with uncontrolled hypertension, type 2 diabetes, depression, anxiety, stomach ulcers, constipation, obesity, and certain cancers. Physical activity is an important part of lifestyle medicine's 6-pillar plan for optimum health and longevity. The other 5 being a plant-centered diet, stress management, avoidance of risky substances like tobacco, alcohol, and drugs, restorative sleep, as well as building and nurturing social connections. Let's highlight a few well-known facts about the benefits of physical activity, as stipulated in this report. It improves muscular and cardiorespiratory fitness, improves bone and functional health. It reduces the risk of lifestyle-related diseases, reduces symptoms of depression. There's a decreased risk of falls, which then translates into reduced hip and vertebral fracture risk. And finally, it helps to maintain a normal body weight. This World Health Organization activity report has detailed recommendations for physical activity for different age groups from infancy to 65 years and older. Recommendations for those with chronic diseases, those with physical impairments, and pregnant ladies are included. The main themes for all the different recommendations are firstly to decrease screen time and secondly to avoid sedentary time by becoming more active. I chose to focus on the physical activity recommendations for those with chronic diseases and the age group of 16 to 64 years, as their recommendations are quite similar. They suggest the following: 150 to 300 minutes per week of moderate aerobic activity, as well as 75 to 150 minutes per week of vigorous aerobic activity, or 300 minutes per week of equal amounts of both moderate and vigorous aerobic activity, which would equate to 150 minutes of each. They advise to include strength training twice per week and not on consecutive days. There should be a rest of 1 or 2 days between the strength training sessions. So this could mean doing aerobic activity on Mondays, Wednesdays, and Fridays, and strength training on Tuesdays and Thursdays. The only section of this document where I, as a physiotherapist and Pilates instructor, differ is a section where they recommend balance exercises for those older than 65 years of age. My recommendation would be to practice balance exercises from the time a child can start walking. The idea is to lay those neural pathways for balance and proprioception down as early as possible, and for the person's entire life, so that by the time that he or she reaches the age of 65 years, that their chances of tripping, falling, and sustaining a fracture will be decreased, because their balance was so well trained. An inactive 65-year-old individual's balance and proprioception is inherently poor, and with the added assault of shortened and weak muscles, leading to an immobile pelvis, which can easily result in a fall, as they tend to drag their feet along while walking. Hence, keep challenging and improving balance from a very early age. As I said earlier, the World Health Organization is serious about raising awareness of the dangers of sedentary behavior, so they emphasize it repeatedly in this document. Let us explore specific exercise modalities and how they can benefit chronic diseases, also known as lifestyle diseases. Firstly, Edwards and his colleagues performed a meta-analysis on 270 randomized controlled studies performed from 1990 to February 2023 that looked at the best exercise methods to reduce resting blood pressure, and they found that isometric exercise training came out tops as the exercise of choice. Isometric training would include exercises like wall squats, planks, pressing the palms together and holding for a few seconds. Any hold in a body position where the muscle group has to contract for a few seconds and then release is considered an isometric exercise. Yusuf Fabadi and his colleagues did a meta-analysis on 20 randomized control studies to establish if exercise training ameliorates the inflammatory status in metabolic syndrome patients. And their findings suggest that the combination of aerobic and resistance exercise improved the following markers in patients with metabolic syndrome: their tumor necrosis factor, C-reactive protein, and interleukin 8 and 10. For the management of obesity, Petredu and colleagues researched the most appropriate exercise programs that would assist in a large negative energy balance, long-term adherence, and beneficial effects on health and well-being. Endurance training appeared to be the most effective in this respect, although resistance training and high-intensity interval training, also known as HIIT, which I will discuss a bit later, play distinctive roles in the effectiveness of exercise interventions, particularly in the obesity cohort. With weight regain being so common, weight loss maintenance is probably the greatest challenge in the successful treatment of obesity. There is an established association between high levels of physical activity and greater weight loss maintenance, based on the abundance of evidence from prospective observational studies and retrospective analysis. Exercise has the potential to alleviate the health consequences of obesity, even in the absence of weight loss. Hence, exercise constitutes an indispensable, often underestimated tool in the management of obesity. Although restriction of energy intake through dietary interventions is more efficient than exercise is in accomplishing significant weight loss goals, drastic decreases in energy intake could result in nutritional deficiencies and decreased resting metabolic rate due to the loss of lean body mass, whereas weight regain occurs if dietary intervention is stopped. Something I tell my patients who are looking to drop a few kilograms is this: weight loss starts in the kitchen. Weight maintenance occurs in the gym. When a healthy eating style, which is focused around whole plant foods, becomes second nature, spending time being physically active tends to follow. Therefore, implementing a long-term eating plan categorized by moderate restriction of energy intake in combination with regular exercise is important. In addition, adhering to an exercise program plays a key role in maintaining a healthy body weight and fat over time, as adding exercise to diet leads to sustained weight loss for up to at least 36 months. Type 2 diabetes. Horden and his colleagues postulated that those with pre-diabetes and type 2 diabetes responded well in terms of improved glycemic control and insulin sensitivity when they performed 210 minutes per week of moderate intensity aerobic training and 125 minutes per week of vigorous aerobic training, and 2 resistance training sessions per week. For diabetics to maintain the health benefits offered by the above exercises, they should not rest from exercise for more than 2 consecutive days. Hodgman and colleagues found positive results with cancer patients when combining high-intensity activity with resistance training to prevent muscle mass loss. Naturally, these exercise prescriptions should be given by trained professionals, as cancer patients present differently at different stages of their disease continuum. They also found that exercise prescriptions showed the following results in this cohort: reduced risk of cancer in the pre-diagnostic period, improvement in drug tolerance and efficacy during treatment, relapse prevention, control of the adverse effect of anti-cancer treatment, and reduced risk of comorbidities. A polypill is defined as a combination of several medications commonly used to treat heart disease and hypertension. Fuisa Luces and Pareja Galliano have shown that exercise is a more efficient polypill than pharmaceuticals. The most robust research outcomes, with exercise being the most successful polypal, has been shown in type 2 diabetes cohorts. Exercise is effective both in preventative and therapeutic measures, having a positive, natural, drug-like effect in chronic diseases like metabolic syndrome, cardiovascular disease, certain cancers, and Alzheimer's disease. Exercise is considered the real polypal as it combines preventative and positive multisystemic effects with minimal to no side effects at a fraction of the price. And lastly, no drug can boast the same results exercise has on the maintenance of muscle fitness. As good as what exercise is for the body, the adage that states too much of a good thing is bad is also true with exercise. This image displays the dose-response curve for physical activity. The y-axis reflects the health and fitness benefits of physical activity, and the x-axis depicts the number of weekly minutes spent exercising. Notice the person sitting on a chair in red, depicting a sedentary lifestyle with no health benefits. As we follow the green arrow, you will notice a gradual, steady increase in the time spent exercising, leading to favorable health outcomes, with the optimum range being between 150 and 300 minutes of moderate intensity aerobic physical activity, which has been found to reduce the risk for multiple health outcomes, and risk reduction continues, but starts to plateau beyond 300 minutes per week. At this plateaued phase, I've seen how patients are more prone to injury due to overtraining and would then benefit from professional coaching in their preferred sporting code. When following the grey arrow, we see that any form of physical activity has low risks, with insufficient evidence to identify the exact level where diminished returns start to occur. But notice the upward curve of the grey arrow starting around the 300-minute mark, suggesting an increase in risk with deleterious outcomes. In a nutshell, this figure shows the estimated time one should be physically active to remain within healthy parameters for optimum benefit from being active. Pushing beyond a certain time limit, and this could be different for different people, could have associated unfavorable health risks for an individual. Now let's take a look at high-intensity interval training, better known as HIIT. Despite what many fitness enthusiasts might think, high-intensity training was popularized by Arthur Jones in the 1970s already, where it was mostly used on elite Olympic athletes. Since then, the name has changed to high-intensity interval training and has gained popularity with people at all levels of fitness. HIIT is characterized by short bursts of high-intensity training of 30 seconds to 3 minutes, followed by a lower intensity activity or a short rest of the same time or longer. HIIT is ideal for those individuals who have limited time for physical activity, as short HIIT sessions are comparable to longer moderate to vigorous intensity training sessions. A 20-minute HIIT session yields similar cardiovascular benefits compared to a 40 to 45-minute aerobic session. HIIT can safely be performed every second or third day, allowing the body time to recover between sessions. Here are some of the researched improvements shown which are obtainable with HIIT training sessions: cardiorespiratory fitness, cardiovascular function, anthropometric variables, exercise capacity, muscular structure, anxiety and depression, shortened training time. HIIT has been shown to be safe provided it is prescribed by a trained professional. Caution should be exercised with clients who are unfit or who have never followed an exercise regime in the past, and those patients who have undergone recent surgery. With all this talk about getting the maximum benefits from different forms of physical activity, let's discuss 5 regions of the world where the word exercise is not mentioned at all. Blue zone is a non-scientific term given to geographic regions that are home to the highest rate of centenarians, those who live to and past 100 years of age. It was first used by Dan Buettner, who was studying areas of the world in which people live exceptionally long lives. They were called blue zones because when Buettner and his colleagues were searching for these areas, they drew blue circles around them on a map. In his book called The Blue Zones, Buettner described 5 known blue zones: Ikaria in Greece, Sardinia in Italy, Okinawa in Japan, Nicoya Peninsula in Costa Rica, and the Seventh-day Adventists in Loma Linda, California, USA. Although these are the only areas discussed in Buettner's books, there may be unidentified areas in the world that could also be blue zones. This group of people are nudged to move every 20 minutes without anyone telling them to do so. And no, they don't have any smartwatches beeping to remind them to move. Movement is engineered into their way of living. They plant and tend to their own gardens, harvest themselves, care for their animals, milk their own goats or cows, knead and bake their own bread, and they walk to wherever they need to be. You'll notice that in the diagram, moving naturally is at the top of the pyramid and holds the smallest share of the pie. Yet, the people from the blue zones still reap the health benefits from natural movement, despite not participating in any triathlon races. There is no need to buy an expensive gym membership if you'll be traveling to another town this festive season. Rather, allow me to show you just how easy it is to pack your gym into your suitcase for the upcoming holidays. Two of the most common excuses I get from patients not wanting to exercise are that firstly, there won't be time, and secondly, there'll be no space in their suitcase for gym equipment. Like with all things in life, we have to manage our time wisely, even when on holiday, in order to enjoy positive health outcomes. And my answer to the second response I'll share with you now. I've gone ahead and weighed the items I'll be packing into my suitcase this December, as I'll be flying and have a baggage weight limit. One pair of Solomon tackies or sneakers weigh in at 530 grams. Two pairs of gym outfits with socks, also 530 grams. One sun hat, 60 grams. A set of 3 resistance bands with different strengths, 98 grams. A skipping rope, 60 grams. And an exercise mat, which is optional, weighs in at 1.4 kilograms. The total weight for your fitness gear comes in at less than 1.5 kilograms and less than 1.3 kilograms if you leave the mat at home. The folk from the blue zones have taught us that a gym membership is not a prerequisite for maintaining optimum physical health. And this December, we'll be packing light and be committed to remaining fit and healthy. Let's challenge ourselves to be creative this festive season, to try a new form of physical activity like horse riding or exploring a new hiking trail. Or follow in the footsteps of Father Christmas and enroll in a Pilates or yoga class. Here are just a few ideas that will make incorporating movement into your holiday itinerary a breeze. For those rainy days, try a YouTube workout of your choice. There are so many options to choose from. Take a long walk or jog on the beach, or go on a guided city tour by foot in the area you'll be visiting. If you're not sure how to use the resistance bands, try searching on YouTube or on the internet for short videos or images that will guide you. Remember not to pull your resistance bands over sharp edges like your sneakers, as this will weaken the band and they'll be prone to tearing. Instead, you can pull the band over your bare foot or while wearing socks. When you're done with your session, let the bands air dry. Apply powder at the back and at the front of the band and fold up into a Ziploc bag. Skipping can be performed indoors or outdoors. Just be careful of rooms with low ceilings. Bodyweight exercises are ideal for building and maintaining muscle strength and muscle mass. Go ahead and do a YouTube search including the time you'd like to perform the bodyweight exercises and simply choose from the list that is generated. Climbing stairs can amount to a full workout if performed for about 25 to 30 minutes. If you're staying in a hotel with many floors, you could combine 10 minutes of stair climbing with 10 minutes of skipping and 10 minutes of resistance band training. Beach volleyball is a good way of soaking up the African sun for that daily bout of vitamin D and getting a good aerobic workout at the same time. Try and enjoy the morning sun, which is before 9 a.m. or the setting sun, as the midday sun can be very harsh and damaging to the skin. Remember to apply your SPF sunscreen as well as a hat, especially if you're exposed to the midday sun. Surfing is an exciting new activity that I am yet to try. It can be a good cardio and balance workout. Kite flying has become quite popular on most beaches these days. It sometimes requires 2 people to man one kite. South Africa is so scenic, especially during December. Why not explore our countryside by foot? I know that the Cape Town area has so many beautiful hiking trails available. There are trails where you have to pay a fee and others that are free. As a family, we love visiting trampoline parks when on holiday. Just a word of caution to those who have neck or back surgery to refrain from this activity, and those with bladder problems. The latest craze in South Africa now is padel or paddle tennis, which is a combination of tennis and squash. This is a fun way of staying active and burning a few festive calories at the same time. The last 5 suggestions on this list have a fee attached to them, but the other items wouldn't cost you a cent to enjoy. So remaining active this festive season and those to follow should never be a problem again. Staying fit and healthy during the silly season is not easy, as our minds and bodies just want to unwind after a long year of hard work. But take yourself back to January of this year and think about those extra kilos that followed you home after your December holiday and how difficult it was to get back into an exercise routine after doing nothing while on holiday. Spare yourself that struggle and do something different this year. Push your New Year's resolution back a month and state it on the 1st of December, which happens to be tomorrow. This then places the responsibility on you to follow through during December too. Select an accountability partner who has similar health goals to you so that the two of you can keep one another accountable for decisions made. By using your smartwatch or smartphone, track your steps and get at least 10,000 steps in per day while on holiday. Window shopping is another good way to accumulate these steps. Only eating when hungry and adequately planning your meals with family and friends is a great way to prevent those indulgent episodes. If you're new to intermittent fasting, start with a 12-12 intermittent fasting, where you fast for 12 hours of the day and feed for 12 hours. This does not mean that you should be feasting for those 12 hours. It merely means eating only when you are hungry during that 12-hour window. Get enough sleep during the silly season, as sleep deprivation has been shown to lead to mindless overeating with resultant weight gain. Lastly, keep in mind that these 2 studies have shown that weight gain during the festive season proves to be very difficult to lose in the months that follow. If we consider that on Christmas Day alone, individuals could consume up to 6,000 calories, which is 3 times the recommended daily calorie intake. What makes Christmas Day in particular challenging is that we are surrounded by high calorie, high fat, highly processed foods, large portion sizes, and alcohol, which is a high-calorie beverage. The combination of minimal to no physical activity and excessive caloric consumption further contributes to weight gain during this time of the year. Let us summarize what we covered in today's webinar. Physical inactivity is detrimental to our overall health outcomes. Physical activity helps to prevent, reverse, and maintain the symptoms of chronic lifestyle-related diseases. Incorporate into your daily routine and prescribe, if you are a healthcare provider, the NEAT principles. Incorporate 150 to 300 minutes per week of moderate aerobic activity and 75 to 150 minutes per week of vigorous activity, with 2 to 3 sessions per week of strength training. Balance exercises should be incorporated by all age groups. Think of exercise as the real polypill. The dose-response curve of physical activity reminds us to keep a balance to prevent overtraining, which leads to overuse injuries. HIIT is to be performed every 2nd or 3rd day to allow for adequate muscle rejuvenation. And finally, if you forget all I've shared today, just simply remember this: sit less, move more. Feel free to peruse these reference lists for more information on the topics discussed in today's webinar. As I take my bow, I trust that this webinar was informative and that there were ideas that you could implement yourselves and can hopefully share with your patients. I'd like to thank you for taking the time to participate in SALMA's final webinar presentation for this year. Our hope is that as we learn from one another, that we'll share our newfound knowledge with our sphere of influence. Feel free to raise your hand to ask a question or type your question in the chat.